Okay. I did want to first, Miss Robin Rosenberg would like to speak, and she would like to fill out a form first, and then also, or second, or yes, that's right. So fill out a form whenever before you're done. You don't have to do it right now.
I would have done a form if I hadn't.
Yeah, that's okay. And so then the guardian ad litem would also like an opportunity to speak, and so we would like to have them come forward. And Teresa? Right, 5E. Flurry. Okay, right. All right.
Good morning, and thank you for inviting me to come up. I was part of the Gabriel Myers Task Force work group. My name is Robin Rosenberg. I'm the Deputy Director of Florida's Children First. I'm a children's rights attorney. I began my work in children's rights on suing the state of Florida to get better mental health services for all children in state care, the ME lawsuit, and I was involved in the resolution of that lawsuit. And I'm also a foster mother of a almost 2-year-old son who I've had since he was 3 days old. And I prepared my top 10 from Florida's Children First, our top 10 actions that Florida can take to eliminate the unnecessary use of psychotropic medications, recognizing that for some children, some medications are appropriate. And I have copies that I'll hand out to you. I won't review them all. Most of them are ones that you all addressed in the questions that you asked of Mr. Sewell, Dr. Sewell. The main thing we can do for children to prevent the use of psychotropic medications unnecessarily is to give them good homes. If we put them, the first time we take them out of care, put them into a home, and that is the home from which they will either be returned to their family or where they will stay for the rest of their life, will dramatically decrease the number of medications that children need. And the second thing is, the minute they have behavioral issues, we provide them the behavioral supports and services that they need. And that means probably more general revenue dollars and behavioral analysis and behavioral support. Don't wait to reach to a crisis point where we have to use a Medicaid psychiatrist to write a prescription. Support the family, do parent training, do behavioral interventions and services in the home immediately so that the foster parent isn't pulling his hair out. The foster parent in this case worked really hard with that child. He wasn't being mean when he was taking toys away. He was at his wit's end to try to find a tool to manage the behavior of the child. He used the wrong tool and it exacerbated it, but he wasn't given the assistance he needed to give positive behavioral intervention to help that child become better. And that support wasn't provided to him. There are many things that we can do within Medicaid to enhance the availability of services that are federally covered, are not currently covered under Florida law and practice. We have to stop the practice of requiring children to change providers when they change placements. Now, if they don't change placements, that's not an issue. But since they are, and since they do, we have to come up with systems that will ensure that the child keeps the same provider. And the last key area that I want to talk to you about is kids. We need to listen to the children. That's one thing that you all didn't discuss earlier. The doctor prescribing needs to talk to them about what their problem is, what the recommendation for medication is, and they need to listen to the child to find out what the child's perspective is, and to obtain assent from the child. Maybe not legal consent, but assent. Yes, I'm going to try this to see if it'll help me get better. And this is what you should be looking for and who you should tell if you're having problems. And the flip side of that is when the child doesn't assent, the child needs legal representation to be in court for them to be their voice. And I would say, and Florida's Children First would say, that all children who have the severity of need that someone's going to recommend a psychotropic medication have severe problems going on in their lives and would benefit from representation of counsel across the board, even if they're willing to take the medications. So I know there are a lot of people here that want to talk. I'll have copies of the full 10 recommendations and happy to answer any of your questions.
Thank you. We'll pass them out. And yes, Senator Wise.
Did you know what Gabriel's attendance was at school and what his grades were and how he did as they tested him out and how many schools did he go to?
We don't know any of that for sure. What we do know is that there was an early recommendation for ESE staffing that does not appear to have happened, and it doesn't from the limited records we had concerning education, it was approximately a week or two before his death where his behavior in school escalated to the point where the school was recommending an ESE staffing, which was way too late. The school should have been involved at the outset. He came into care during the summer. The beginning of the school year, there should have been an ESE staffing so that his behavior issues, and they were significant with regard to other children, could be addressed in a coordinated way between the school and between his caregiver and his after-school program, because he was in after-school as well. And that, again, that lack of communication there, and there was a failure, I believe it was a recommendation in the comprehensive behavioral health assessment, which was timely done at the beginning, to work with the school, and that didn't happen early enough.